Hello, this is Dr. Stackwood, and this video is on the things that you can do on your own if you have disc bulges or herniations. And as you may have seen on the previous videos on diagnosis and treatment, there's a wide spectrum of different types of bulges and herniations, and so therefore there were different treatments based on the amount of bulge or herniation that one has. And so there are other variables like your fitness level, the amount of arthritis that you have, your age, that will have an impact on what you do on your own. And so with any of the exercises or postures that are given, obviously before you do any of those, you should be doing the complete health history consultation exam and having any diagnostic tests reviewed. So a lot of patients come to me and ask, first of all, about sleeping position and what should I do because I have pain either during the night when I first lay down or sometimes first when I wake up in the morning. And obviously you can't be aware of your posture when you're unconscious, but what you do prior to falling asleep has a huge impact on what it's like during the night and when you wake up. Specifically, it goes back to the anatomy of the disc. Remember, we talked about the fact that you have this outer fibrous ring, which is called the annulus, and the nucleus inside is moldable. In other words, it changes shape, and when you're moving around, it's very pliable, but after 20 minutes of being in one position, it starts to harden. So therefore, if you're laying down with your laptop or a tablet with your neck craned forward just before you fall asleep, then obviously you're going to be putting the neck disc in a bad position. However, if you just take some time to do a few basic stretches and movements, and then you lay down with the proper positioning to your neck and your lower back, specifically on your back, and for a lot of people with support underneath the neck, then that will mold the disc into the best position so that you're much less likely to wake up with tension in the neck and the shoulders. With regards to the sitting position or ergonomics, we're seeing that the standing desk is becoming more and more popular, and it's not that standing is better than sitting for disc bulges or herniations or any particular condition in general. It's just the fact that you need to change your position. And so we recommend that for pretty much everybody. And also the other concept is the fact of remembering to change your position. After 20 minutes, again, the discs have molded. So what you want to do is have some type of movement every 20 minutes. And for most of us that are concentrated on our work, unfortunately, we forget to move. So we have to have some type of reminder. There's a software called rsigard.com. There's a lot of free source softwares that do this. You can set a timer on your phone. Whatever works for you, just to remind you to get up and move. But for those of us that do have to sit for long periods of time, it's important that our arms are not extended out on a keyboard because this puts a lot of tension in our shoulders. Oftentimes our neck tends to crane forward, which puts the weight of the head forward, which puts a lot of stress on the bulges and herniations in the neck area. Also, for the lower back, when we're sitting and compressing, what we are doing is making that disc bulge even worse. So just getting up and moving around is a plus, but also decompressing. And so if you simply put your hands on the arms of the chair, extend the elbows out so that you're taking the weight off of your spine every 20 minutes, just for 30 seconds or so, that can often create that vacuum temporarily to get that jelly a little closer to the middle of the disc and take the pressure off of the nerve. Now as we go into the idea of exercises, it's important to remember again that there are many different fitness levels, and so depending upon what you've already been doing, obviously we have to review the history. But generally there's an order that's ideal, and there's an old concept that you should stretch first, which we know is not true because if your muscles are tight and you stretch, you're much more likely to actually strain something. So what you should be doing is some type of warm-up with cardio. So your cardio exercises that are best for disc bulges and herniations are usually taking weight off of the spine, like swimming or water classes. Certainly walking uphill on a treadmill is much better than running. Elliptical machines are also good. Sitting down at stationary bicycles, there's either recumbent or the sitting up, depending upon the type of disc bulge or herniation, can also be a nice alternative. Sometimes mixing all three of those up in one session, in other words, walking uphill and for 5 or 10 minutes, then going to the stationary bicycle, then doing the elliptical, can be a way that you're not putting yourself in one position too long. The second part of exercise should be the resistance or the toning. And this is ideally done in what's called a circuit, where you would do one exercise of an arm, then you would do one exercise of a core, and then you do leg exercises. So you're not doing 3 sets and pushing any one particular area. So for example, when you're doing a circuit and you do an arm exercise, you may do a bicep in one of those, and then you go to the front of the stomach. Then when you go to the leg, you may do the front of the leg or the quad. And then in the next circuit, you may do a tricep, a different arm. Then you do the lower back, and then you may do the back of the leg, so that you're doing a different muscle and you're not overstressing any one particular muscle. One particular exercise that's not good for disc bulges and herniations in the upper body is the overhead press, particularly if it's done with a bar and weights, because that loads the spine and puts more weight on the disc. If you're going to do that type of exercise, you should do one hand weight at a time and then switch and do the other side, so it's only half the weight. There are a number of different core exercises that actually help the disc bulges and herniations, but without getting into details, there's certainly a lot that can also aggravate it, and so we certainly should be consulting you specifically on those. There's also leg exercises that can be isolated. In other words, you can do a leg extension, you can do a leg curl, you can do inner and outer thighs. You can certainly do the leg extensions and leg curls one leg at a time. Certainly squats and leg presses are putting, again, a lot of load onto the spine, so they should never be done with like a bar or a squat rack. And certainly getting a leg press machine with both legs is certainly going to aggravate the disc bulge or the herniation. So an alternative to doing the squats and the leg presses for leg resistance exercises is a machine called the multi-hip. It's basically a clock dial type of device with a round pad. And what happens is that you can do leg extensions, leg curls, you can do inner and outer thighs, and then right after doing the resistance exercise, you can actually use that same device for the foam roll. And what this allows is that you get all 4 directions of the leg muscles, the quadriceps, the hamstrings, the ADD adductors, and the ABD abductors. So you're getting all 4 directions of both the resistance as well as the foam rolling with this one machine without compressing the spine. And now with regards to the second activity, resistance exercises, just a note on why it's important not to do squats or leg presses or overhead presses, because they're compressing the spine. I've had a number of people come in to me that say that they're doing these and they don't feel pain during the time, or they haven't had pain for months doing these types of exercises. Back to the anatomy of the disc again. The inner 2/3 of the disc, that outer ring, that's not pain sensitive. In other words, the jelly of the disc could be pushing out 2/3 in a normal healthy disc with no pain. So in other words, you could be doing squats for months or years and slowly tearing the inside of the disc with no pain at all. And then this is what's very common. A person will come in, they're tying their shoe, they're brushing the teeth in the morning, and then all of a sudden they feel something sharp in their lower back. And what's happened is the years of abuse has finally caught up to them to the point where they finally tear the last fiber, and that's when they feel the pain. So in other words, there's delayed onset with muscle tears, just like there is with a disc herniation. So it's important on a preventative basis not to do compressive type of exercises. And this is also why it's important not to do quick jerky type of exercises. For example, the swinging type of kettlebells. That also puts a person in a bent forward and twisted position in some of those exercises, which is the most likely position to get a disc herniation. And then of course when you get into competitive sports, when you're doing uncontrolled activities, when other people, for example playing basketball, are going to be bumping into you and you have unprepared motions, again, not good over a long period of time if you're trying to be the healthiest person possible and avoid the arthritis and the disc herniations that build slowly over a period of time. So we've gone through the first two, the cardio and then the resistance. The third part of exercise should be foam rolling. And what I mean by that is where you're trying to get into the specific muscles and break up lactic acid, scar tissue. You can do this not only in the legs, but a lot of people don't use the foam roll for their spine. So you're getting more of an isolation on each of the vertebrae to get blood flow into those areas before you do the fourth category, which is stretching. But back to the foam rolling, you can also do this with a number of apparatus like tennis balls. There's a number of different things that you can do to get more individual movement within the spine where you're going at each specific level. So finally, when you've gotten to the fourth activity out of the cardiovascular, the resistance or toning, the foam rolling, and you've gotten to the stretching, you're much less likely to be pulling or straining muscles. What is common to most people that have disc bulges and herniations is that decompression is one of the best things for them. And again, depending upon the level of herniation and the amount of the herniation, you can certainly overdo this concept. But we talked a little bit about the fact that you can decompress simply sitting in a chair by coming up on the arms of the chair and basically getting your buttocks out of the chair so that all the weight goes into your arms. You should feel a decompression through the spine. Similarly, if you're in a pull-up position or actually doing pull-ups or dips at the gym, then that's also going to be decompressing the spine as well, and can often create that vacuum that gets that jelly a little closer to the middle and takes the pressure off the nerve. And then there's something called an inversion table. And I'm sure you've seen some of the infomercials where you have someone laying on their back. By the way, this is something that you can buy yourself for roughly $150. You're laying on your back, it holds your ankles, and you can vary the angle at which you tip yourself. And I always recommend for people that do the inversion table that they start with just 5 minutes a day, and they also don't go in too far of an angle. In other words, don't put your feet too far above your head. You can certainly go all the way upside down with these tables, but that often will overstretch you, and you could have that delayed onset where you feel the pain later on or the next day, even though it feels good while you're doing the inversion table. And again, don't do the inversion table unless you've consulted with a doctor about your disc bulge or herniation.